Welcome back to Glendale Today. I'm Vice Mayor Steve Frate, and we're at Banner Thunderbird Medical Center in the newly opened Heart and Vascular Center, which features the West Valley's only biplane angiography suite. Now, what does that mean? Well, I'd like to introduce Dr. Ahmed El Gangaihi, an interventional neurologist who will tell us what this means to the community, and Sarah Badalamenti, Banner Thunderbird Stroke Coordinator, who will join us to talk about the new stroke program and the epilepsy monitoring unit. Welcome. Doctor, can you begin by telling us about how Banner Thunderbird is becoming one of the leaders in the West Valley in neurosciences?
Banner Thunderbird Medical Center became one of the leaders in neurosciences in the West Valley. We achieved this through the use of highly specialized techniques, advancement in technology, and experts in the field. We have the Heart and the Vascular Center here that enable us, and through this we're able to perform highly specialized procedures that were only done downtown or in the East Valley. To give an example, we started to do intracranial thrombectomy for stroke patients. Through specialized minimally invasive techniques, we're able to thread our micro wires and catheters into the brain in stroke patients that have a major blood clot, and we're able to extract this clot out. We also have 24/7 coverage for neurosurgery here, and it's provided by our colleagues from the Barrows Neurological Institute.
Very interesting. Now, you mentioned the advanced technology. Can you explain how the sophisticated equipment in this suite helps us and how it treats your patients? And this is actually a new level of care, so this is state of the art, right?
State of the art, exactly. So we have this biplane machine that gave us the ability to take X-ray pictures simultaneously from the anterior view and from the side of the brain. And these X-rays are so detailed that enables us to see the minute details during our intervention and plan our treatment accordingly. We can do 3D rotational angiogram to give us more exact anatomical distribution of the vascular bed inside the brain, and to determine the exact treatment options needed to treat these patients. We also can look inside the blood vessel. We look from this picture, we see outside, but we can also look from inside of the blood vessel and determine which type of stent or equipments we're using. This biplane machine can save us time during the procedure nearly to half, and save the patient radio opaque dye contrast nearly to half. It also saves and provides us with the safest way to provide the service to the patients.
That's amazing. Now, Sarah, what can you tell me about the stroke program here at Thunderbird?
Well, we're a primary stroke center. We have dedicated beds for our stroke patients, both in the intensive care unit for our neurosurgical patients and stroke patients. And we also have a stroke unit on the progressive care telemetry floor as well that provides care for these unique needs of our stroke patients. We have a number of nurses who are specially certified in neuroscience nursing. And actually all of our nurses in the emergency department, the intensive care unit, and on the stroke unit all have specialized training in stroke management. And all our nurses maintain certification in the National Institutes of Health Severity Stroke Scale, which is an international evidence-based tool that is used to assess the severity of stroke. We also have stroke alert process here, where we have a dedicated stroke team that responds to all of the stroke patients that come in the facility through the emergency department or in the hospital when symptoms of stroke occur. And that team responds efficiently and quickly to provide emergent care for the patients with stroke.
Doctor, I would assume that these type of neurosciences, there's a need in the West Valley for this?
There's a need nationwide. Stroke is a high priority. Treatment of stroke is a high priority in the whole nation. And you know, it's the first cause of disability in the United States, the third cause of mortality in the United States. In the Northwest Valley area, this area is actually has the highest, or it has the highest incidence of strokes compared to the rest of the valley. So we definitely need this equipment, these tools, and well-trained individuals to help to decrease this disability and mortality in all stroke patients.
Well, I'm certainly glad it's here in the West Valley and in Glendale. Now, Sarah, you also recently opened one of the West Valley's first epilepsy monitoring units. How's that unit doing and how does it work?
We actually have the capability here to monitor 2 patients at any one given time on our stroke unit, neuro unit, with video EEG monitoring. So we can monitor them for a period of time instead of a snapshot of time, which is typically what we do as a traditional EEG. So we can look at patterns, trends, we can look at issues that the patients have when they're having these seizure type events to plan the care more directly. This is a planned admission, so they usually come in the beginning of the week and they can stay here anytime from 2 to up to 10 days to have that treatment monitored, and the recordings are looked at daily to provide the best care and treatment for our patients that have epilepsy and seizure issues.
And this is the first time it's been offered in
Yes.
Banner or the West Valley?
This is the first here at Banner Thunderbird, correct.
Oh, Doctor, what's next for the neuroscience program? What are you looking forward to?
The amount of expansion that we have is unlimited. We have the ability now to treat cerebral aneurysm by coiling, treat head and neck tumors by embolization, even multiple sclerosis patients. The main goal that we have here is to accurately diagnose and treat and decrease the pain and suffering of all neuroscience patients.
Well, I have a question. I don't know if it's Doctor or Sarah. Could you answer this? You know, you're talking about time is important. What is the time frame? I mean, you have to see the patient as quickly as possible. Can you give me an idea of what the best scenario time would be?
What we try to do in our stroke alert process is get the patient to the CAT scan within 25 minutes. We try to get them to the point, if they're a candidate for that clot-busting TPA medication, the golden hour, so 60 minutes from the time they hit the emergency room door or when the stroke symptoms occur to the time we give the drug. Fortunate here at Banner Thunderbird, we have Dr. Elgin Gahey. Having him here and the kinds of interventions that he can do kind of has the opportunity to extend that window beyond the traditional 3 to 4.5 hours, so that the clot retrieval and interarterial clot or interarterial TPA can be done, and that can potentially allow better outcomes for our patients and decrease the severity of stroke that many of these patients face.
I totally agree with Sarah. In the past, after 3 or 4 hours, there wasn't anything that we can provide to stroke patients. But now we have the ability to go and extend this time window up to 8 hours, and sometimes in some strokes up to 12 and 24 hours in order to help decreasing the disability and the mortality of these patients. And I think this is a great advantage that we have here in this hospital.
In response to your question about the time is of the essence, it's very important that people recognize the signs and symptoms of stroke and get to a primary stroke center emergently, calling 911, get to the facility as soon as possible so all of these procedures and events can happen. And it's important that everybody out there knows what those symptoms of stroke are. And oftentimes we use an acronym called FAST. It means face, facial droop, arms, there's weakness in one arm or the other, there's a drift. S is for speech, difficulty speaking or talking or understanding speech. And then T is for time. Get to the emergency room, call 911.
I want to thank Dr. Elgin Gahey and Sarah Badalamenti for taking time to tell us about the advancements in neurosciences program here at the Banner Thunderbird. And I also want to thank Banner Thunderbird Medical Center CEO Tom Dixon, who was with me earlier at the studio. I'm Vice Mayor Steve Frate. Thank you for watching Glendale today. Thank you very much. Thank you, Sarah.